Good afternoon. Welcome to our live updates on COVID-19. This is our next in a series of town halls on Friday. I'm Libby Garvey, Chair of the Arlington County Board, and I'm going to be your host along with my County Board colleague, Christian Dorsey, this afternoon. We're pleased to have all of you here, and we've got a good lineup of our county's executive leadership team. And we have today with us County Manager Mark Schwartz, Deputy County Manager Jim Schwartz. We've got Dr. Aaron Miller, who is our Director of Emergency Management. We've got Dr. Ruben Varghese, who's our Director of Public Health. And also with us is Jane Rudolph, Director of Arlington Department of Parks and Recreation. I want to thank everyone for joining us today. And it's great to have everybody here. We look forward to questions. We're looking now to probably be moving into phase 1 pretty soon. As the governor announces it, we're right now in phase 0. And that means we need to continue to stay home for essential trips, practice social distancing and wearing face coverings when you're out in public, and also washing your hands. And these are all very important. They're simple, but they're important measures to make sure that we start to stop the spread, which we have been doing, of COVID in our community. And we will talk about that a little bit on how we're doing. We are continuing to monitor the metrics that were outlined by the governor that are going to allow us to move to phase 1. So these metrics include a downward trend in the percentage of positive tests that we see over 14 days here, a downward trend in hospitalizations over 14 days, an increase in testing and tracing, and enough hospital beds and intensive care capacity to handle some surge, and an increasing and sustainable supply of PPE, personal protective equipment. Currently in the region, we've got about 17,036 cases. This is as of 5 p.m. yesterday, 346 hospitalizations, and 89 deaths so far. In testing, so far, we've been able to test 6,683 Arlingtonians, and that is really important to give us a good sense of what's happening in the community as far as COVID goes and tracking the spread of the virus. We are working hard to make sure that everyone who needs it has access to the testing during this pandemic, and no matter whether they have health insurance or not. We have been supporting the Virginia Hospital Center drive-through testing facility at our Quincy Street site across from Washington and Liberty High School for some time now. Last week, we added a walk-up testing site and a sample collection site at Arlington Mill Community Center at 909 South Dinwiddie Street. That clinic is open weekdays between 1 to 5, but to be tested, you have to have a clinician referral and then schedule an appointment by calling 703-558-5766. But on Tuesday, this coming Tuesday, we will be hosting a one-day testing site, which we hope will happen again. But for the moment, it's just for this next Tuesday. And that'll go from 10 a.m. to 6 p.m. at Barcroft Sport and Fitness Center. And anyone in our community can be tested there without a doctor's referral and without an appointment. The pop-up, it's a pop-up. There's no barrier to testing, and we plan to conduct 1,000 tests for Arlingtonians there, supported by by the state of Virginia. And we very much are looking to get the message out to people who do not have access to health insurance, health care, are more vulnerable and have more difficulty getting access to facilities. And we really want to do that. And that's part of the reason we're hosting it at Barcroft Sport and Fitness Center, which is right in my neighborhood, but we happen to be the area with the greatest concentration of cases of COVID right now. So I'll turn it over to my colleague, Christian Dorsey, to talk a little bit about health needs and food and other resources we've got.
Thank you, Libby, and good afternoon to everyone. In addition to our health needs, there are certainly a great many other needs that have manifested over the last 8 or 9 weeks. And the need for food and other resources in our community really remains at an all-time high. Cumulative unemployment claims are now at about 12,000 in Arlington during this pandemic period, and that represents about 8% of our labor force. And many others, even if they have retained their jobs, have seen their hours reduced and their income reduced as well, and this has resulted in significant needs. This past week, we increased the visibility with signage in median strips all throughout the county with information on how residents can get questions answered on COVID, find access to food and housing and other resources, as well as how to connect with us on any other areas of interest. And this has dramatically increased calls to our call center. In the last week alone, we've seen 3 times as many residents call in to access any of these services that may meet their needs. And to help address these unprecedented resource needs in our community, the board has accepted and allocated our share of the CARES Act funding. That's the federal coronavirus funding that was made available through the states, and Arlington's share comes to almost $21 million. And those resources are going to help support numerous programs and initiatives that we've stood up over the last couple of months, including food assistance programs like food banks and increasing meal delivery for people who are homebound, and also grab and go meal programs. It's going to provide resources to enable us to continue to provide emergency cash assistance to people so that they are not subject to eviction or other impacts that may befall them through a loss of income. It's going to provide resources for us to buy the critical PPE that you've heard about, the equipment for not only our workers, but also to make available to anyone who is on the front lines of dealing with individuals in responding to the pandemic. It's going to help us ramp up testing that Libby talked about to ensure that we have the adequate testing to understand how this virus is being spread and to control any outbreaks where they may occur. It's also going to help us with providing support for small businesses and our grant program, which is going to enable these small businesses to hopefully maintain a continuity of operations, be able to keep people on the payroll, and to be ready to resume activities when they are allowed. And I should note that Arlington Public Schools has received their own separate tranche of funding that will allow them to address COVID-19 related impacts. But I do want to stress that all of this funding, while very much appreciated, is by no means sufficient, and in my mind, not quite equitable. You should understand that these revenues cannot be used to fill the gaps in our budget that are expected from reduced sales and meals taxes, as well as other taxes that the county collects. And the portion that we got from the state is allocated based on population, not necessarily based on the health and economic impacts that a community has suffered. Now, before we get to your questions today, I do want to put in a plug for something that has been a priority all throughout the year, and that is the Census 2020. Unfortunately, the current pandemic has significantly hindered our outreach efforts to get everyone counted. And we still have approximately 30,000 households in Arlington that have yet to respond to the self-response phase of the Census 2020 effort. Our current response rate is hovering around 69% overall, and we see lower response rates in areas that have large numbers of multifamily buildings, people who are limited in their English proficiency, and people who have lower incomes. But we can't stress how important it is for everyone to participate. The census is not only about representation, it's also about critical resources that flow from the federal government to support our schools, our hospitals, critical infrastructure, our public works, and vital projects. So if you have not yet filled out your census form, please do so. You can do it online, you can do it via phone, or you can do it by returning the information that was sent to every household in the mail. And support is available for residents who do not have English as their first language. You can find information on how to respond at Census 2020census.gov. And if you have the capacity, please be an ambassador to try to help us drive up the count. It's secure, it's easy, it's convenient, and most importantly, it's important. So, Libby, why don't you kick us off with our first round of questions?
First round of questions. Thank you so much, Christian. And I will just say that, part of the whole point of the census is while we're focusing on COVID, government continues and the work of our government continues, and the census is very important to that. So thank you for that message. And I'm going to just claim moderator's privilege and start off with a question of my own to get us going, if I might. And this is for you, Dr. Verghese. Ruben, so we get numbers every week, and I, presented some today, but could you put those numbers in perspective for us? What does that mean? The trends, what are we really seeing here in Arlington and the region? What do these numbers tell us, and what do they not tell us? And maybe a little bit about what that means for going into phase one.
Sure. Thank you. I want to remind people about the context. And it may be very obvious, but I want to make sure we sometimes forget about it. We are, when you look at the numbers without that context, it can be a mixed picture. So let me remind everyone, we still have community-wide transmission in the Washington, D.C. area, in Northern Virginia, and in Arlington County. We have an epidemic of COVID in our community. In that context, we've been, you'll see numbers going up. That's because there's been more testing, and we know that the virus is out there. So that should not come as a surprise. But when we look at the metrics that the governor had proposed back on April 24th, that we looked at as a region several weeks ago, how are we doing in meeting some of those metrics? There's been improvement in those metrics over time. So while you may see cases going up, some of the metrics that were specifically mentioned, and whether you mentioned these earlier, but I think it's important to remind people, one of them was the percentage of positive tests over a 14-day period. And when we've looked at that information from 2 weeks ago and now, we're seeing improvement, a downward trend in that. That's important to note. Hospitalizations over 14 days. That's hospitalizations related to COVID. They've also been going down over the past 14 days. Obviously, we still have another week to go, so I'm hoping those trends will continue, and my colleagues and I will actually be meeting. We meet regularly to look at those numbers. We know that currently there are enough hospital beds and intensive care capacity. So no one has gone past their surge capacity, the additional surge capacity. All of that is to say that things are improving, and we need to watch carefully, because remember, when we reopen, more people are going to interact, and we want to make sure that those interactions are safe and that we don't have a spike in cases and a reverse in hospitalization trends going down and so on, because we want to do this safely and protect each other from germs.
Thank you, Dr. Verghese. Christian, in this how to do things safely, one of the major themes we've been seeing is when are parks going to open? I bet you've got a question for Jane Rudolph.
Yes, and joining us today, as Libby mentioned at the outset, is the Director of Parks and Recreation, Jane Rudolph. And, one of the great things about Arlington, number 4 in the nation in terms of our park system, is that we have people who have a great affinity for our parks resources, and they have been very much disappointed over the last couple of months. So why don't you tell us about why we made the decisions that we made to close the parks as we did, but more importantly, how are you looking towards moving to phase 1 and reopening our parks resources to the community?
Thank you, Mr. Dorsey. I appreciate the question. We had to close down our parks mostly because our park system is not fenced. We have a very open park system, and it's one of the great things about our park system. But as to that, we were not able to have the safe social distancing that was really needed to happen. So we made the choice to just have our 49 miles of trails open and our community gardens open during that time where we were at our stay-at-home order. As the county is moving, or the state is moving to phase 1, we are excited to announce that tomorrow, May 23rd, we are opening up our parks. This means our parks will be opened. The amenities within the parks, like tennis courts, playgrounds, those will not be open, but the parks will be open for people to enjoy in the same way that they've been enjoying the trails, for use within your own household, keeping safe distance of 6 feet apart. We recommend that you wear a mask, but we're really excited that tomorrow we will be able to open up the park system again.
Well, that is terrific and welcome news to a lot of people. How are you thinking about the timetable for other facilities that at this time must remain closed, but when will people be able to enjoy basketball and tennis and other things. How are you thinking about that?
Great, thanks again. We are thinking about it in a phased approach. Different amenities have different ability to keep safe distances. For example, as you mentioned, basketball, it's really hard to keep a safe social distance with a basketball. At the same time, though, tennis, I think you heard this on your call last week, people are eager to get back into tennis because you can keep those safe social distances. So in early June, I'm not going to commit to a date right now, but early June, we are looking forward to be opening our tennis courts, our pickleball courts, our dog parks, and several other amenities like our picnic shelters, and also for walk-on play in our fields. So we look forward to be able to open those in early June. There will be no league play. There will be no reservations for these amenities. We will have messaging at each location for unique guidelines of how to keep those safe social distances as people use them. We are looking at guidelines that we are recommended from the CDC and from other places, as well as for example, USTA guidelines for tennis. So you will be seeing signage going up in early June, and we will be making an announcement in advance of that as well. From there, as we move into phase 2 and others, we will look to open up other amenities like playgrounds, like basketball courts, maybe have the opportunity to bring back league play when we're not limited to the 10-person gathering.
Thank you.
Yeah, thank you. And thanks for mentioning the dog parks, because we've gotten a number of questions about those. I think there are a lot of people and their dogs who are very anxious to have those parks opened up again. We've gotten a question about, saying that DC is going to be making an announcement on Tuesday about reopening, and when are we going to make such an announcement? So we're not a legal entity like the District of Columbia. We're in a little different position, and I am not sure. This might be Mr. Mark Schwartz, a question for you about how does it legally happen that the governor's made an order. How does that fit in with what we do?
Thank you, Madam Chair. So for Arlington County, if people have been paying attention to the sort of interplay between Northern Virginia and the rest of the Commonwealth, the governor is the one who makes the decision about what kind of restrictions there are and when it is that those restrictions will be released. And so as Dr. Varghese spoke to at the beginning of the conversation, we're expecting, based on the metrics that we have and that we've been tracking and the state's been following along with us, that the governor will make some sort of decision, probably Tuesday of next week, we're thinking, something like that, where he will make a determination as to whether Northern Virginia can move into phase 1. Right now, we're planning that will happen, and we're going to be making a number of decisions related to how we'll handle phase 1, but all in the context of what kind of authority we get from the governor.
Thank you. And I wonder, this is probably for Dr. Varghese again. How are we going to go? So when we're in parks and things, what about face coverings and things? What does it actually mean, phase 1 for us? And, we continue to very understandably get concerns about our retirement and assisted living facilities and what's happening there. So as we move into phase 1, would you talk a little bit about how things are going to happen that way with coverings for everybody and how we're handling our assisted living facilities?
Sure. So let's take the first question about face coverings and public spaces in general. Everyone should have a face covering available when they're going out. The primary purpose, to remind everyone, even with reopening, and it's a small level of reopening, as I said earlier, the germs are still in our community. So we need to remember that that's possible, and you and I can each transmit to other people. So the purpose of the face coverings is to prevent a significant amount of our germs leaving our mouths to other people. So assuming that you can't have that contact in a public space is not the appropriate thing. Carry it with you, and when you're passing people, if you're going to be beyond a few seconds, you need to have a face covering from my perspective, because we're trying to prevent the spread of germs, and it can happen. Yes, outside, yes. Will it be less likely? That's true, but that doesn't mean it's not possible. And so if the goal is to try to reduce the chance of germs transmission, the more we can wear face coverings in those settings when you're around other people and you cannot control your distances, that's the purpose of the face coverings. And remember, when you go out to grocery stores, you're doing this to protect the essential workers who are there. They will not be protected by face coverings. They're protecting us as clients from that. And so we need to protect those essential workers. So I ask you to do your part to protect those sorts of essential people. With the assisted living facilities and long-term care facilities, what I can tell you is, like the rest of the nation, we also have people at risk in those facilities. And if germs get in, we have to wait till it gets through. That's why we want to make sure that the community doesn't have the germs nearly as much, so that we reduce the entrance of these germs into these facilities as well. That's why it's a community-wide approach to help with some of this. We work with every assisted living facility and long-term and skilled nursing facility to provide them with recommendations for infection control. One of the things that people need to remember is local public health is recommending guidance for these facilities. We are not a regulatory authority, but within that frame, the facilities work with us routinely to try to implement things, and that's the role that public health has to see how they're doing with those implementations. But we need to protect these facilities. They're not going to be opening up to visitors anytime soon, because the germs are in the community, and we don't want to bring those in other than through limiting that exposure, if that helps.
That helps. Thank you very much, Ruben. And I'm going to turn it over to Christian, who's probably got a question. But first, one follow-up question for you, Dr. Varghese, which we get sometimes. So we're advocating face coverings for people, as you talk about, but people know these aren't the M95s. They don't seal perfectly. Do they really help?
They do help in preventing the germs, reducing the volume of germs that come out. They're not perfect seals, that's true. But all the studies that we're seeing, the more you do that, as collectively, we're reducing the amount of germs that are coming out. So we're reducing people's exposures. I know people get frustrated with this, but it's a layered approach. It's not just one thing that will happen that you do it. You don't just wash your hands or wear a face covering. If we put these things together, remember, we're doing this to help reduce community-wide transmission. We'd like to go back to the day where we don't have COVID in our community. And the sooner we do that, the better. So the longer we can tolerate things like wearing face coverings, as we start interacting more, that's a way to reduce the exposures and reduce the infections, and we get out of this COVID mess sooner.
Thank you. Yeah, every little bit helps, and these are actually a lot of help. So a lot helps a lot. Christian, over to you.
Thank you, Libby. So we're getting some questions on Facebook about next week's testing opportunity on Tuesday at Barcroft, which we've talked a little bit about. And maybe it's a good time for Dr. Miller to come on the line and talk a little bit more about who we desire to get tested on that day, and who we want to make sure access is prioritized for. And then also how we're going to get the word out to those people.
Sure, wonderful. Thank you very much for the opportunity. As you've heard, in partnership and through the availability of a contract that the Virginia Department of Health has made available to localities, multiple jurisdictions across Northern Virginia have put on these one-day testing events to increase the availability of COVID tests in communities of need and where we're seeing disproportionate impacts. As we have been going through this, to date in Arlington, there are about 6,800 tests that have been performed. A little over half of those have been at the site that the county has in partnership with VHC and at our Arlington mill site. And so we know that we need to increase our capacity, particularly where we see and where the data shows us that there's a disproportionate impact. As was mentioned, this is for individuals that are uninsured, that are underinsured, that do not have access to regular health care, and that otherwise face barriers when accessing testing. We know that, for instance, work is an issue, right? And so we've looked to extend this time in conjunction with a contractor to make sure that we can be a little more flexible with the hours. That's why you'll see it open until 6 p.m. We've designed it to be not only drive up, but also walk up, so that we remove additional barriers for individuals in our community who may not have a vehicle. We're going to have translation services on site. You're going to have Arlington County employees there to help guide you through the registration process. And as was mentioned, we are really attempting to target those individuals who show us, the data shows us, are most at risk and are seeing a disproportionate burden. So those are individuals that are in areas of the 22204 zip code. And that's why we've chosen the particular location that we have.
All right.
Thank you.
Thank you. I think I'll go back to Ms. Rudolph again. We've gotten a couple of questions about opening. One is, all right, so we're opening the parks. When can we open the inside facilities? I'm going to guess that you don't have a definite answer for that, but if you could discuss that. And also, are we going to be putting up signs in our parks trying to telling people about the face coverings and what they should do? Are we going to be modifying the kind of signage we have in our parks and how they should be used?
So on the inside, our inside our buildings are a tricky conversation, and we need to figure out when is the best time to reopen them. And the best time to reopen them is when we're enabled to do the kinds of activities that community centers are meant for. Community centers are meant to bring people together and build community, and that's hard to do when we are socially distant. So we are going to work with Dr. Varghese, with the other team, to figure out when is the appropriate time to open. That will not be part of our phase one. So in early June, when we're opening up those additional facilities, we will not be opening our community centers. But when we can, we do look forward to trying to bring back some level of programs into our centers at the appropriate time. We also are going to be looking for increased signage in our parks, both for, as I said earlier, the guidelines for which you can use the different amenities. And then we also will look to put additional signage about the 6-foot distancing and recommendations of wearing face masks as well. We were just actually speaking about that this morning, and look forward to working with the team to get increased signage in our parks.
Great, thank you. That is helpful. Christian, do you have another question? I think there are a lot of them coming in. I've got one as well if we would like. All right. If you're hesitating, I'll go ahead. I'll go ahead for it. Outside dining. We're getting questions about that if we're opening up. Mr. Mark Schwartz, this might be for you. I'm not sure. Are we going to open up outside? What are we going to be doing about outside dining?
So as I mentioned in my earlier response, if the governor gives us the go-ahead and to move into phase one, there are some criteria that the governor has already laid out, several pages of criteria actually, about how we would go about starting seating service at restaurants, but only outdoors. So we're looking at that right now. We are going to assume a week from today that there will be some outdoor seating. We're also looking at, and we'll have more details on this hopefully Tuesday or Wednesday of next week, that if restaurants are interested in expanding their outdoor seating capacity, or those that don't even have outdoor seating capacity want to embark upon having that, what we hope will be a fairly painless administrative procedure for restaurants to go through to get that permission. There's a lot of logistics involved with that. Even if, first off, we will be having a conversation with the board about it, but secondly, just saying that you want to expand your capacity, whether it's into a parking lot, and we've received requests for that, and also into the sidewalk or the right-of-way, seems in some cases to be a straightforward request, but depending on who asks and where it is, it requires a lot of attention to detail. So just a few things that we're thinking. We'd like to allow restaurants to expand their capacity outdoors. We're taking a look at potentially how to manage the sidewalks better and maybe give some more room for people who want to do grab and go. We also have a potential conflict. We want to make sure that people who can do the pickup and drop off that they're doing can continue to pull up to a restaurant. So there are some conflicts there that we'll have to work out. We're going to have a lot more details about that. We're also going to be sure that to the extent we have outdoor dining, that we have signs up at all the establishments saying what the capacity is, so people as they go by will know what's available and what isn't available. So a lot more to come on that.
Thank you very much. And I'm going to just take talk about a little bit the intersection of outdoor dining and our parks, and encourage folks, if you're going to use our parks, that's great. Get some nice carry out from one of our restaurants. Spread out a blanket on the, in the ground. I haven't looked at the weather report, but I'm guessing out of those 3 days, we're going to have some nice ones. and enjoy the parks, but stay socially distanced. Support our restaurants, but use carryout. So hopefully it'll be a beautiful weekend and we'll be able to enjoy it in a very socially distant but friendly way. Christian, you got some questions for us?
Of course, we've got tons. So these are coming from Facebook, and just for everyone's understanding, we have questions that come in via the Facebook live chat as well as through text messaging, and we're doing our best to address as many as we can, thematically grouping questions so that we can get the most impact with our time. We do have some questions about virtual meetings of organizations which have been put on hold for the last couple of months, specifically the Board of Zoning Appeals for people who are seeking variances, et cetera. So I'll start and then turn it over to Mr. Schwartz for more details. But over this past week, the county has further extended our continuity of government ordinance, which does allow us the opportunity to do things remotely. That authority then has to be married with our capacity to stand up meetings in accord with primarily the sunlight provisions of public notice and public participation for people to actually engage in such meetings. But specifically for the Board of Zoning Appeals, we do have a plan forward to get them to meet so that they can begin to address their docket, which is piling up. Mr. Schwartz?
Yes. So the Board of Zoning Appeals, there's a schedule that we're working on. Also, the Board of Equalization, which handles real estate assessment appeals. For this, I'm going to encourage people to go to our website and listen through the presentation that was made at Tuesday's county board meeting during the afternoon. And there's a number of slides and a flow chart that explains how we're going about making these decisions. We have scheduled a number of virtual sessions, mostly with those bodies like the BZA and the Board of Equalization that absolutely have statutory deadlines, and along with the Planning Commission, which is scheduling its first meeting for the beginning of June. A lot more details there. If people who serve on commissions or are interested in issues about commissions have questions, I encourage you to get in touch with commission members, and they can get in touch with county staff, and we'll get back to you with a status of what's going on.
Great. So Christian, because we've got Ms. Rudolph with us here, and we've got a question that we've been hearing a lot about, I'd like to ask you, Jane, about the issue of people behaving badly with their bicycles in particular in our parks and creating trails in our woodlands that are pretty destructive of our parks and what we can do about that. It gets to the whole issue, I think, of enforcement and compliance, and if Mr. Schwartz or someone else in the team would like to talk a little bit about that issue more generally beyond the issue with parks, because it's really huge as we move to phase one, I'll invite that after, Jane, you finish with your answer here on the bikes and the bike trails.
So it is a difficult issue, and our natural areas throughout our park system are precious. And you are not allowed to ride bikes on the dirt trails, on these natural trails, and yet it continues to happen. Some of this, I think, is because a lot of our natural areas actually go along our trail system, which is along the 4 Mile Run, and the trails are just adjacent. We really ask people to take personal responsibility to not use those trails for bikes. It really wears away and causes erosion. We ask you to stay on the paved trails as you enjoy that. We have been working to do some different things like putting mulch on the trails and trying to break it up. But ultimately, it's about personal responsibility to not take your bikes on those trails. There is some level, we have our rangers and our rovers, particularly our rangers who are going out and trying to provide messaging regarding not using those trails. Our rangers do not have enforcement capability. They are really like goodwill officers who are there to help people learn, have best practices. So those rangers will continue to be out there. And that is about where we are. But again, I really encourage people, stay to the paved trails.
Thank you. And is there a number, if you see somebody behaving badly, and I think often it's our young people who are a little bored, I get that. Is there a number to call?
There is a number to call. And that number will be on our website. I don't have it on me at this moment because there are a lot of phone numbers that we are providing these days. But The numbers are on, we do have phone numbers on all of our signage. And I will ensure as a follow-up that we provide that, make sure that those numbers are clear.
Thank you. I think that's a good point for the signage we're going to put up. Yes. Mark, you're nodding your head.
Yes. So, tomorrow morning, if people wake up and they see 1,000 people gathered in a 10-foot square area and it's causing them anxiety, they can call 7999, which is our general purpose COVID hotline, and we will see what we can do in response to that. And I'm going to return, though, to, at this point, I feel like I've been saying this a lot, which is that we cannot, as a county, we do not have the staff or the personnel to enforce what are, I think, reasonable requirements across the county. And a number of people have asked, what are you going to do about it? And we'll do our best, but I would encourage everybody to self-police and pay close attention to the rules. It's not like we want to do this because we want to be difficult, but stay 6 feet apart, follow all those criteria. We will come up with some more details about how we're going to respond to complaints as they come in. Our sister jurisdictions throughout the Commonwealth have faced this issue since they moved into phase 1. And I will just say we cannot police ourselves out of non-compliance with this. It's going to have to be a societal effort to establish some norms and try to comply with that. And I strongly encourage people to be thinking about that and practicing good behavior.
Thank you, Mark. Christian, we've got a lot of questions coming in. I've got some here, but you might have some too.
Sure. While we have Jane here, so we know exactly what we're planning on doing as far as DPR, summer programs and camps, and those who contract with the county to publicize their camps. But how do private non-county affiliated camps, what's the status of those? And is there anything that we point people to understand what may be happening with those private entities? Are they subject to the governor's overall guidance on how they can operate, or are they following the guidelines of some of the other organizations and associations that you mentioned?
So for private camps, so Arlington County we as DPR have 2 different types of camps. We have the camps we run, and then we have camps that we contract with. On Wednesday, when we sadly announced that we are not going to be able to offer camp, those contracted camps also are not being offered. There's about 132 of those camps. Outside of those camps happen in the county facilities and in school facilities. Outside of that, in private entities, those camps need to comply both with state guidelines and other guidelines on how they can happen. They may be able to provide camp if they follow all of these guidelines. So my understanding is there is not a restriction from having camp. It's just that the restrictions of being able to provide it were such that we were unable to provide it at the level that we do before. In DPR alone, we had over 4,000 people registered with us for camp for the summer. That volume and those number of kids we could not achieve the new guidelines and offer camp safely for those kids and for our staff as well.
Thank you. Back to you, Libby.
All right, thank you. We had a great question from someone wanting to volunteer. How do you volunteer? There are a lot of ways. I'll start it off and invite people to add on. We've got Volunteer Arlington, which is great. You can just, search on Volunteer Arlington, it will pop up. And there are many ways you can volunteer there. That's a great clearinghouse. For contact tracing and more professional kind of volunteering and way, you can go to the Medical Reserve Corps. That I believe is on our website, and also it can take you to Richmond, but you put in your zip code and it comes to us, and we are looking for people to do more contact tracing. There are lots of neighborhood groups. There's the Arlington Community Corps, which started up soon, which is coordinating a lot with PTAs. Your local PTA are doing a lot. Churches, AFAC. There's a lot going on. I think Arlington, Volunteer Arlington is probably the best clearinghouse to go to directly, and the Medical Reserve Corps, but I invite anyone on this call to volunteer with some other suggestions for folks. Ruben, Dr. Varghese.
Yes, thank you. I wanted to let people know they can find on our website at health.arlingtonva.us/medical-reserve-corps, and to learn more about the Medical Reserve Corps. We also have on our Arlington County page information of what contact tracing is actually, how we do it and our philosophy. So those of you who want to do contact tracing through the Medical Reserve Corps, that page on our website will help you understand what that entails and what we're looking for. Thank you.
Thank you. Anyone else want to add anything else? Christian?
All right, let's move to some other questions. Back to our theme, one of the things that people are noticing are that construction sites, often don't have people who seem to be complying with social distancing requirements as well as PPE wearing. And to what extent are we allowing and, or not allowing, but proactively looking to have people who may be patrolling neighborhoods, whether they be a police department or other official personnel, reminding people of the guidelines that they should be adhering to conduct their work safely in public?
So let me answer that question. So our inspection staff is out and about during the day, and to the extent that they come across a site that where the construction workers are not engaging in proper social distancing, we've been in touch with the development company and the construction owners. But again, I'm just going to remind everybody, we can't be everywhere at once. And sometimes actually we know what happens is that people will see poor conduct. They'll let us know and we go out to take a look. By the time we get there, it's not visible to us. So again, we have worked with some companies have actually shut down sites and have been responsive to us. And I'll tell you, not everyone has been completely responsive. So we're continuing to pursue that. And it's a difficult issue, and we're going to keep at it. But we'll, again, just have to do our best and see what comes of it. And so I welcome suggestions from people if they have some thoughts on how we might be able to do a better job there.
Thank you. One of the requests we got in was, could you please give full phone numbers when we give numbers? So I'll just toss two of the main ones out there with the full number. If you've got questions about COVID, you're feeling sick, you're not sure about something to do with COVID, you can call 703-228-7999. Again, it's 703-228-7999. And if you need assistance with food, worried about covering your rent, and those kinds of questions, you can call 703-228-1300. Again, that's 703-228-1300. Christian, if you got a question there, I've got, I'm going to toss one.
We've got tons. We've got tons.
I'm going to toss out one simple, it's
Sure.
not simple, but it's one that one person wrote in. It's not exactly in a theme, but I think it's something people are going to start thinking about more. And I think it's probably for Dr. Varghese. This is someone who wants to go out to California to help a family member out there. Is it safe to fly? If you fly, what should you be considering? Would you like to tackle a little bit of that one, Dr. Varghese?
Sure, I'll try my best at this point. We know that some travel will be absolutely necessary, and people will have to take some of the same precautions, trying to keep as much distance as possible. And you need to ask yourself, is it truly essential travel for you to take the risks that are involved? And then some of the things that I've advised people, it's like, is the flight at the beginning of the day or the end of the day? Can you get a less crowded flight so that you don't have to have as crowded a plane as possible? You should be using face coverings. Ask the airlines what they're doing to clean and so on. So those are some of the things. But as I said to even personal friends, if this is important for you, whatever your decision is, then put those things in place. If it's not important, do not travel.
Thank you. And I saw an article where you can call different airlines are doing different things on spacing and stuff, so you can call and kind of make your decision that way as well. Christian, got a question for us?
Absolutely. We've had a couple of questions concerning the Arlington County Fair, the very beloved August annual tradition. And we'll say at the outset before inviting Ms. Rudolph to talk further, the Arlington Fair, even though it is eponymous with Arlington County, is actually conducted by a nonprofit organization that is not a governmental entity. So the decisions about conducting the fair and how the fair is conducted are subject to the decisions made by that specific nonprofit. But that said, we work closely with them, and a lot of the considerations that have gone to our adjusted schedule for the summer will absolutely have to be a part of the fair's decision making. So while, at this point we can't speak for the fair, I think I can express pretty fairly that the prospects for a fair of the types that we have known in years past, highly unlikely given the circumstances this year. Ms. Rudolph?
Thank you for that. I think you summed it up pretty well. We support it. The Department of Parks and Recreation supports the fair for the county. And so that's why you passed it over to me. It happens at TJ, at the park, and in the middle school. And we are working closely with them to see what can be achieved. And similarly to the announcement on Wednesday about camps, we will need to evaluate very closely what can happen and what would be allowable by the governor's orders at that time. So we will continue to work on this and work with you, Mr. Dorsey, on it, and hopefully come out soon with an announcement.
Thank you. Libby, if I can continue while we've got
Please.
Jane here.
Please,
there have been a few questions about pools. We have our county pools in partnership with APS. We also have community pools that are owned by specific neighborhood entities. We have apartment communities that have their own pools, and other folks who operate swimming facilities. What are the status of all of those, given that we are about to enter pool season? And more specifically, how does this relate to the governor's orders and his plans for phased reopenings for the Commonwealth?
Great, thank you. As my department actually operates no pools, I will try to answer this as well as I possibly can. But we are working with APS. They are looking at opportunities to open their 3 pools, which they oversee at the 3 high schools. And I know they are eager, following the governor's guidance, to do so. Similarly, for the private pool clubs and the buildings, there was guidance in the governor's phase 1 about reopening pools for mostly lap swim. And I know those organizations are trying to see how they can successfully open in that phase 1 to achieve that lap swim. I can't speak for them, but I know for a fact that they are all working on that guidance and looking for a way as we move, if the order is lifted for next week, for Arlington to go into phase 1, could that happen? My also understanding is that Northern Virginia Regional Parks, which operates the regional park system for us and operates a lot of great pools, including Upton Hills and Arlington, will not be open this summer.
So,
Thank you.
Mr. Dorsey?
Yes, Mr. Schwartz.
Yeah, actually, I got to add, Dr. Varghese could add to this, but there's some questions that are coming in on the chat line about people who are wanting to know about outdoor pools that are privately owned. And so there is some guidance that the governor laid out in phase 1 that talked about outdoor pools could be open if they are set up for lap swimming and had a limitation to 1 person per lane.
Yeah.
And I don't know, Ruben, if you want to add anything else to that.
Oh, I think you've got that correct, that it's 1 person per lane. Some people are trying to be creative about, can they turn their pools into lap swimming, which will be a different story.
But at least at this point, the guidance that we have from the governor is, at least for the foreseeable future or for phase 1, the way in which many people have used community pools will have to change. And those decisions for whether or not they're going to be operated are not a local government decision. They're going to be the private decisions of the pool owners under the guidance from the state.
All right.
Libby, you got another one, or you want me to keep going?
I got another one. Yeah, I think this is sort of from so we're back to compliance again and concern, which we hear that's a lot. Going to a grocery store, people aren't wearing the face coverings like they should, and I hear stories both ways. I think we all saw the story of, I think it was a Costco employee that kicked somebody out and it went viral for not wearing a mask. Did it politely, but some stories are really strictly enforcing. They've got hand sanitizer. They're strictly enforcing things inside to keep the distancing. Some stores are not. the question is, what can we do to enforce that? I will suggest that if I go to a store and I see that kind of, I just don't go in the store, and I would let the store owner know that that's the reason, because there are plenty of places you can shop safely. And then, Mark, to get to you too, as we open up county buildings, are we going to require our own employees to wear face coverings and such? I think I know the answer, but I'll let you answer it.
Let me handle that last question first, and then actually I might ask Jim Schwartz, who's been doing some work with our mask squad, to comment a little bit on some of the other points. So for county buildings, right now, most county buildings, I'm not talking about parks, recreation centers and libraries, actually are open. There's not any counter service that we're providing. Almost all the services move to virtual setup. And we're like, as with any other business, we are considering how and when we would bring staff back. My direction to county staff as they think through that is that we will make sure that we have social distancing in the workplace, and that county staff, when they're not able to keep that social distance, will themselves have to wear masks. And we're working through, presumption right now is that when people want to come in and do business with the county, that we'd ask them to wear masks. We also have the ability to require them. There are some issues with some people who might not be able to wear a mask. So we're working through a lot of issues with that, but the presumption is mask is a good thing. And we're going to encourage that. I'm going to flip it over to Jim, though, who could talk a little bit about some of the mask efforts we have underway.
Thank you. Jim.
Yeah, thank you, Madam Chair and Mark. So we're going to follow the model that the Cooperative for a Hungry-Free Arlington has really done a fantastic job in dealing with food insecurity during these times. And we're going to be putting together a kind of a task force that'll look at masks. This is going to be a collaborative between the community. We already know that there are a lot of organic efforts going on in the community, people making masks and making them available to neighbors and friends, and perhaps even through organizations. So we're going to see if we can bring all of those efforts together, and in doing that, then identify where there may be gaps. We hear from people on occasion that they don't know where to get masks, or that the sources that they have identified may be out right now. So we're going to see if we can collectively bring together all of those resources, and the county will then augment the mask effort. We made an early order that got delayed in some of the shipping, but that we expect to see in the next 7 to 10 days. We have an order of 30,000 cloth face coverings that'll be coming in. That is what we will be issuing to our employees to wear in the work that they do, and then we'll be making those available. The remainder we'll be making available to the community, and then subsequently we are expecting an additional 20,000 cloth face coverings that will be in hopefully in a few more weeks, and those again will go to this community distribution effort.
Thank you. All right.
All right, Libby, I'll take the next question, and it concerns transit. And as we move into various phases of reopening, we're going to have more and more people who are going to be out and about utilizing transit. What are our plans to marry this very real circumstance with the need to keep transit vehicles sanitized and to promote safe social distancing, given the fact that the way we operate transit is to be efficient, to maximize the number of people who are occupying a vehicle?
Well, it's
a good question.
That's a good question. It's proven not to be a lot of easy answers. As you know, that for our art bus system, we since, and I don't even know how long, it's probably been a month and a half, we've been requiring boarding only from the rear door. And we're also have really stepped up our cleaning and disinfecting program. And I will tell you this, because I've seen pictures actually for the first time ever, the New York subway is shutting down to do that kind of cleaning from 1 o'clock to 5 o'clock in the morning. No matter how often we clean, there will be the circumstance where a surface that's just been cleaned, someone comes in and then touches it. So I would, going to urge people, to the extent that they want to use public transit, and we encourage people to do that, that they need to come prepared, be able to try to maintain that distance, try to wear a mask. And Ruben may have some other hints about how to make it easier, but one of the unfortunate parts of this will be we are going to have some capacity issues. If everybody comes back who wants to use transit, which we want them to, we will not be able to carry as many people in a bus or in a subway car.
Could I follow up a little bit back to the face coverings, which keeps coming back? Can we require people on our transit? In other words, you don't get on one of our buses unless you have a face covering. Can we require that?
Well, right now, Metro is requiring that, and I have to check with our ART operator on this. My understanding was that we were also going to require it on ART. It's been required in other local transit systems. So yes, and saying, this is one of the things that came up in your earlier question, requiring it, absolutely. What does that mean? That means you do it, but we also need to make them available to people who show up and do not have one with them. So there's that, again, that distribution issue that we need to work through.
Yeah.
Well, and let me just add a little bit on the transit side. While you're going to have Metro and hopefully every transit operator requiring it, we also do have to marry that with not wanting to put our bus and transit operators in the position of being in confrontations with people who will not comply. So just as we don't force our drivers to aggressively deal with people who don't pay fares, we also can't be in the position where a bus operator is putting themselves in jeopardy with someone who is recalcitrant and not complying with mask provisions.
I would also add on that, which is that we've talked with a number of grocery store owners. We've had several conference calls with them. They too have spent a lot of time and energy making sure their staff have masks. They understandably are very uncomfortable. They do not want to be in a position where they have to enforce it as people come through the grocery store door and tell people turn around. They will do it gently, but there have been several confrontations. And I'm just going to encourage people to do what our chair said. If you go into a place and you see that people aren't wearing masks, believe me, it will be very effective if you turn around and leave, because people still are motivated by profit.
They still are. Yes. Could we continue this discussion a little bit? Because I've heard this a number of times on emails and today, questions coming in. What about people who are living in buildings, high-rise buildings, or at least high-rise enough to require an elevator, and their compatriots, their fellow residents in the building, don't seem to be complying? They don't seem to be wearing masks, face coverings. They're not being careful. What kind of recourse do you have if this is basically your home and the people sharing the building you live in are not really complying with what would be good practices? Is there much we can do, and is there anything we are doing to try to change that dynamic? I think it's another difficult question, Mark.
Yeah, no, I think I'm going to ask Dr. Varghese to comment a little bit about, what our authority is inside multifamily units. And I have received a number of emails from people who say that, I live in a multifamily apartment building. I'm behaving, doing really well. I wear a mask. I go out, and the other people there do not. And I think that there's some recourse with building management, but beyond that, I'm not really sure I have a particularly clever or thoughtful answer on that. I'm going to ask Ruben to see if he's given any more thought to that.
Sure, Mr. Manager. I've given thought to it, and you don't have any more authority than I do. Unfortunately, there is no public health authority to mandate this. It would have to be some sort of act, probably at a much higher legislative level. Having said that, obviously working with your building management to see if that sort of behavior can be encouraged would be probably the best recourse for people to practice. And once again, like any other setting, if there are times when it looks too crowded, if you can't avoid you going at those times, not getting into crowded elevators and so on. If you're able to take stairs, to take the stairs at those points. It's the same advice in some ways when you're going to the grocery store. While it is your home, it is also their home. And so I'm going to leave it at that's going to be the clash of values that we are also experiencing today.
Yeah, it's very difficult. We can go over our time some. I had sort of a general overall question I think that I'd like to ask, but it might be more of an ending question in some ways. Have you got some more for right now, Christian?
Oh, totally. Yeah. So a couple of people have asked about libraries specifically, and I don't know who wants to get ready to talk about this, but if you haven't followed what is known about the virology at this point, prolonged indoor contact or exposure is very much a risk indicator. While we know that surfaces are not so much of a risk, it is people sharing the same space indoors with or without masks, which increases risk. That is something that we know. So I just use that as overall framing before talking about the way in which our libraries operate. Mr. Schwartz?
Yeah, thank you, Mr. Chair. No, former Mr. Chairman.
That's fine. Chairman Emeritus.
Chairman for life, we try now. I was going to say that for books in our libraries, we've given a lot of thought to this, and I don't know where Diane Kresh finds the time, but we're looking at a sort of pick up, drop off kind of arrangement for our library books. And we're also looking at studying perhaps once the books come in, what we do with them to make sure that they're free of virus. Now, I know the CDC keeps changing its position on whether virus can live on surfaces, but we hope to, at some point in June, and I'm not going to say a specific date, stand up some sort of service like that. And in the meantime, strongly encourage people to use our online resources for books. And, you pointed out really the fundamental issue we have there, which is the same issue that Ms. Rudolph's dealing with in our community centers. Having a lot of people packed into a space, milling about, makes it very difficult for us, at least in phase one, it's not even permitted to do that. So hopefully, as we move to phase two, we'll have a lot more flexibility about that. And, I'm not, maybe Jane doesn't have anything to add, but I know she's been thinking through the issues of how you would actually open a center or open a library. And some of those questions revolve around how people come indoors, how they move in stairwells, a lot of very complicated issues.
Jane, would you like to talk about that a little bit?
Sure, great. I think Mark really hit on it, which is our centers are all really different. We have different types of spaces. For example, like at Arlington Mill, it's on 5 stories with 2 elevators, and it's hard for people to go up and down. Other ones are more spread out. So we really just need to work with our partners in public health, Department of Environmental Services, and elsewhere to when we are able to open, when the phasing says we can begin to open, what is it that we're going to open, and then what are we opening for? What experience are we going to be able to provide people within those centers? So there's a lot that we are working through right now that we want to ensure that we don't open hastily, and then when we do open, we have a really good plan that keeps both our staff and the members of the public safe.
Thank you. Christian, any more?
We do have quite a lot. I think it would be good for us to maybe reiterate and summarize sort of the interplay of these levels of phases and what is not solely the county's call. Overall framing, and then I think Mr. Schwartz, you should take this. But people are wondering, will we be able to determine when we enter phase one? Is that going to be something that the governor ultimately defers to the requests of Northern Virginia jurisdictions, like he did with the 2-week extension? What is our thinking about what the governor intends for that? And then number 2, decisions about moving into subsequent phases. Do we have any indication that the governor will continue to look at regional specific variables in making those determinations?
So let me reiterate something we said earlier, which is that the authority for us to do anything flows from the state. and it's the governor's decision as to whether, because his order is still in effect that has us at phase 0. He extended that for us through next Friday. So the answer will come from him. And as I said, we're hoping to hear that answer early next week. And you've hit upon something which we've been thinking about, but which I rather, if I talk about it, I may start to cry, which is what are the criteria moving from phase 1 into phase 2? And so that's a whole other set of issues. And, maybe we'll have the fortunate ability to talk about that as things improve.
Thank you.
Yeah, I was going to ask about that. I don't know if, how are we doing on, back to sort of the data and the numbers. I know we're constantly kind of refining the information that we get both for the National Capital Region and here. Are we comfortable that we've got pretty good data about what's going on? And I think the answer is maybe not as comfortable as we'd like to be. And what are we doing to continue to refine the numbers? Dr. Varghese, I think that's for you, perhaps.
Sure. So as I mentioned earlier, we have been working as a region and with the state health department to see where we are with the original metrics that the governor put out. And we've been able to get better data from the state to be able to look at the metrics and how we're performing. And as I said, overall, I think we are doing much better than we were 2 weeks ago. We want to see that continue. My suspicion is, and this is how other states have done it as well, going forward, the metrics that we had entering into phase 1 will form the base, at least for what will go on in the additional phases as well, because they're all very appropriate things. We'd like to continue to see, say, hospitalizations continue to go down, that we want more testing to occur with fewer positives. All of those things would still remain valid metrics. We just want it to be even better than entry from phase 0 to phase 1 to phase 2. We would like that to be the continuing. If there are additional metrics, that of course we have to leave to the governor, but these I can imagine would be some of the ones that we continue to follow, because if there's any worsening of that, we want to be thinking about, is that appropriate to then move on to the next phase?
Thank you. And I'm going to do one follow-up question, if I might, sort of a little bit on the negative side. And then, Christian, I'll turn it over to you to wrap us up and get us out on a positive note. You can do that for us.
Okay, thanks.
Yeah, because so it kind of begs the question. So we enter phase 1, and I think if people are really good about the face covering and everything they should be doing, I think we'll probably do fine. But what if we don't do fine? What if people come in from the outside and suddenly we start to see a spike in cases? Then what? And we may not even have an answer for that, but I'd love to your thinking and how you might approach thinking about that.
Well, the Northern Virginia health directors and I meet every single day, and sometimes in the weekend, and we're doing this as well. We're always thinking about not only reopening, but maybe would we ever say that reclosing is something that needs to be considered. Obviously, we won't make that specific recommendation as much as saying, where do we think the metrics are going? So if we see a consistent rise in the wrong direction for the metrics, we will also let all of you know. And then it's a decision of the governor ultimately, but what does the region then request? If we really are seeing the wrong trend and starts going back in the direction, say 2 weeks ago, we will be looking for that as well. So it's not just a unidirectional look that we're looking at.
Thank you. All right, Christian?
So, why don't we do this? Because I don't know if we can get at every unanswered question so far, but I think a theme that has emerged is, while we've talked a lot about the restrictions that are in place and how they will be eased and what to do about people who don't socially distance and wear PPE, maybe if we could have Dr. Varghese talk a little bit about what should people do proactively as they go about re-entering communal life in terms of their own behavior, so that they are both protecting themselves, but also importantly, protecting the rest of the community. What do you advise beyond masks in terms of minimizing trips? What should people do when they enter public facilities in terms of using public restrooms, and how should people take ownership of how they can be responsible citizens as we reopen under whatever phase or guise?
Sure. Thank you for the question. So some of the things that, I've managed not to talk about things like washing your hands, covering your cough, staying home when you're ill. All of those things still apply. They are a critical cornerstone of personal behaviors that will protect other people and ourselves to get better. So those things still apply. In some of the things that you talked about, if you are going places, will you need to use a bathroom? It may be appropriate to maybe see if you can go after you use the facilities at your home and then limit your trips so you do not have to use facilities outside. Obviously, if you need to, quite appropriate. But it's planning your trips, your behaviors at these places. Are you using hand sanitizer when you get back into your car? Are you using the sanitary wipes that they may have provided you at the facilities? All of those things are important, but then once again, it's what do you do with your hands? Are you going to put them towards your face? Okay, that is a change of behavior that we need to have going forward. And it should become a new context or standard that is culturally appropriate to tell even Dr. Varghese, stop touching your face.
It's hard. It's one of the advantages to masks because it kind of reminds you.
Yeah.
But it's hard.
So, Libby, I'll just say before turning it over to you for the last word, if there are specific questions, health-related questions about COVID, remember the number, 703-228-7999. If there are needs that you have during the pandemic, 703-228-1300. If there are any questions that have not been answered during this town hall that are burning for you, we advise you first to check the Arlington County COVID website, where many of these questions may be answered. But if you're still not satisfied, please be sure to email us and we will get you those specific answers. And you can just email countyboard@arlingtonva.us and we will make sure you're provided that information. Thanks so much for everybody. This was a robust chat, both on Facebook and through the text questions. And we thank everybody for joining us today.
Well, thank you, Christian. Thanks for helping keep track of all those questions. I want to thank everybody here for joining us. It's a great discussion. Reminding people the work of government continues. We do have like a report a problem app. So if you've got something going on with your trash collection or something that's a concern, there are other ways to reach us. We continue to do our open door Mondays. And you can virtually join a board member, sign up for that. We rotate. We're happy to see people. We're having some good discussions there. And just really thank everybody for joining us. Thank everybody for what you're doing to keep yourselves and everybody else safe. Wash your hands, stay apart, wear that mask. Have a great picnic in our parks with carry out and have a great weekend. Thank you so much. Thanks, everybody.